Hello everyone, I am Dr. Ruchi Srivastava, a senior gynecologist at Sharda Care, Healthcity, Greater Noida. We all know or we have heard about miscarriage. So today I will be talking about miscarriage, which is also known as spontaneous abortion or pregnancy loss before 20 weeks. It is really important to understand the risk factors of miscarriage or spontaneous abortion. Two very important risk factors are the first being the maternal age. As the age increases, the incidence of miscarriage keeps increasing. For example, up to 34 years or 35 years, the incidence is 12 to 15%, but as soon as the patient or the woman crosses 35 years, 35 to 39 years, the incidence is as high as 25%. The second important cause is the number of previous pregnancies when she had her abortions. If there was zero abortion in the earlier pregnancy, the incidence remains the same as 12 to 15%. But after one abortion or two consecutive abortions or three consecutive abortions, every time the 5% keeps increasing. So it increases up to 35%. How do we treat miscarriage? We give certain medicines and then the uterus contracts and it expels the product of conception. If it still persists, so see, this dead tissue inside the uterus has a tendency to attract bacteria, so this can lead to infection also. We have to go in for the surgical intervention, that we call it as a dilatation and evacuation or suction and evacuation. What I would suggest is, rather going in for these problems, it is always better to know the solution that the miscarriage should not happen. So what comes in role is the lifestyle. As I said initially that the obesity has a very strong correlation with miscarriage. So always have a lifestyle in which you take a proper diet, healthy diet, and exercise every day so that the obesity will not happen, and this is going to be, we can exclude this one of the risk factors. If you already know that you are diabetic or hypothyroid or any other medical problem you have to take the treatment regularly and continuously. Rather, in pregnancy, we sometimes increase the dose also. So you always have to know that what problem you are having and why you are having this. You should not stop the medicines at any point of time, especially diabetes, thyroid and hypertension. These are the regular medicines to be taken for the lifetime. So this can prevent you to have miscarriage in your next pregnancy. As I said, genetics also plays role in miscarriage. So the karyotyping, if it is a recurrent miscarriage, so karyotyping of both parents has to be done. It's not only about mother, the father also need to get it done because the genes can come from both sides. So that is also one of the options if it is a recurrent pregnancy loss. What is recurrent pregnancy loss? If 3 or more consecutive losses are happening, we call it as RPL or recurrent pregnancy loss. There is a list of separate investigations which we do, and believe me, once treated properly, these miscarriages can be prevented. Thank you.